Hey guys, Dr. J here. How do I know I'm gluten sensitive? I get this question all the time. One of the biggest things I just see is patients are sensitive to gluten. Now there may be a dose dependency, and the more inflamed and the more your immune system is provoked and on alert, the more sensitive you could be to it. Now, why is this? Well, in today's wheat supply, there's a lot of genetic modification, which has increased the gluten content. You also have glyphosate being used for lots of reasons, for the GMO and for the pesticide such, but it also is used to desiccate the wheat. So it dries it out. And so you have a lot of glyphosate residue, which can increase gut permeability, make your digestion go a little bit more wonky. And so that can make it harder to process the wheat. And so when we talk about gluten, we're talking like wheat, barley, rye. Those are the major kind of gluten types of things, right? Wheat is typically gliadin, but the wheat, barley, rye are the major things that people associate, gluten to, especially if you're celiac. And so how do you know? First thing is do an elimination diet. You may notice that gluten symptoms are not just your bloating, your gas, your diarrhea, your constipation, or even malabsorption, right? Those are your conventional symptoms, especially someone who's celiac may say, hey, I have these issues. I'm not gaining weight. I'm anemic. My white blood cells are low. My platelets are elevated. These are all signs that you could have serious celiac malabsorption connected to gluten, but you could be gluten sensitive where you don't have that same level of destruction in the microvilli and the small intestine, but you're still sensitive to the gluten. You may have autoimmunity, more thyroid, more Hashimoto's, maybe type 1 diabetes, maybe even some malabsorption, maybe some low selenium, low zinc, low stomach acid because you're not absorbing your nutrients well. And so I always recommend doing an elimination diet, pull it out for 3-4 weeks, see how you feel. Do you feel improvements in fatigue, in brain fog, in joint pain, in mood and energy? Because these are all classic symptoms that I see patients improve on when they cut these foods out. And if you add it back in, you may see a provocation of it getting worse. So good elimination, provocation is good. There are some good genetic tests I talk about in my Thyroid Reboot book. Thyroidreboot.com is the site for it. You can find it. But in that book, we talked about the HLA-DQ-A1, B1. We talk about the HLA-DQ2, 6, and 8. These are genetic tests that can increase your risk, can show that you have the DNA that can make you at a higher risk for gluten sensitivity, right? So if you have that, it's another way to look at it. It's a cheek swab, and you can look at that to see if there's an issue. I'm a bigger fan of the elimination diet first, but it's nice to have a good test on that. So you may notice those symptoms improve, and they may not be the classic digestive issues. Hope that helps.